Hello, hello. So in this screencast, we are going to look at vision. So first of all, let's just kind of talk about what's happening when you see an object. Basically, light waves are bouncing off that object and coming into your eye. And so as we begin to explore the eye, what we really need to figure out is how is it that the eye helps light waves that have bounced off various objects reach photoreceptors located on what's called the retina in the back of the eye. So the photoreceptors, I mentioned briefly earlier, the rods and cones, they're located on this thing called the retina. And so to understand the eye, we need to understand how do we get that light to hit that retina. And then once it does hit the retina, the photoreceptors are going to fire an action potential and send that to the brain. So let's begin to look at the anatomy of the eye. So the first thing that the outermost layer of the eye, and one of the first things you notice when you look at someone's eye is this white part. That white outer layer of the eye is called the sclera. And you can see that sclera is all the way around the eye. And this is kind of weird to some people. Like it is kind of like a ball. Like if you pulled out somebody's eye, it's like a round ball. And the outer layer of that ball would be the sclera. And that's what provides shape. So I know in history you may have heard the quote from the Revolutionary War where the one guy said, "Don't shoot until you see the whites of their eyes." He could have just said, "Don't shoot until you see the sclera," and that would have saved some time. So the problem with the sclera, though, is that it is opaque, meaning light can't go through it. It's white. And so if we're going to get light to the back of the eyeball here, we need a little window in that sclera. And that window is the cornea. I had a joke about the cornea, but it's kind of corny, so I'm not going to say it. The cornea is this clear area in front, and its job is simply to let light into the eye. It does actually also help focus the eye a little bit, and if you've heard of laser eye surgery, I'm sure, in laser eye surgery, they're actually changing the shape of that cornea to affect how light gets into the eye. On this picture, you can kind of see that bulge of clear stuff. That bulge is the cornea, and if you just get somebody you know to kind of look sideways and kind of look end on at their eye, you'll see a very clear little bulge there. That is the cornea. Next is the choroid. So now that we're kind of inside, we're more in the middle layer. In blue here, we have what's called the choroid, and this is just a jet black, a very deep black color structure. And the point of that structure, black absorbs light waves. And so the purpose of that is to just sort of absorb any stray light waves that are not absorbed by the retina. So remember, the retina is what's supposed to be absorbing the light waves, but if some light waves get past it, it's going to hit that black choroid and then just kind of be absorbed and done, out of commission. So that reduces reflection of any light that would hit the retina. That's the purpose of that. And it's a very pretty black. When we dissect eyes, you'll see the very pretty black. Now, some animals, including cows, which we'll do the cow eye dissection in class, they have an extra structure that we don't have. It's called the tapetum. It's this kind of light blue structure. This is a reflective layer, and it actually aids in night vision by allowing the light to pass through the retina twice. So what I mean by that is here's the light wave coming in, this white line. It passes through that transparent window, the cornea, and then it enters the eye, and it's supposed to be absorbed by the retina. If it's not absorbed by the retina, however, it can go back, bounce off this tapetum, and then come back through the retina a second time, which basically means we got two chances of that particular light wave of being absorbed. And so if it's a very dim lighting environment, like at night, then this structure helps you take in more light waves and see better. Interestingly, though, this means that light is going to be coming out of the eye. And this explains why when you see animals sometimes at night, it looks like their eyes are glowing. It's because light's going into their eye, bouncing off that tapeta, and then coming back out. Humans' eyes don't glow like this because we don't have that tapetum, which is too bad because that's pretty cool. Their eyes like glow. Okay. Next two structures are kind of paired. We've got the iris and the pupil. Both of these you are very familiar with, whether you realize it or not. So the iris is the colored portion of the eye. So if you have blue eyes, your iris is blue. If you have brown eyes, your iris is brown. And then the pupil is simply a hole. It's that black circle right in the middle of your eyeball. So the pupil is literally a hole, and then the iris is this kind of circular disc wrapped around that hole. The iris's job is to regulate how much light passes through that pupil, and the pupil's job is just to let light through. So, the iris can kind of go like this, depending on the scenario. So we can play with this. Here's what I do in class, and you could just do it on your own. Go to a bathroom or something where you can turn off the lights and look into the mirror. So what I do is I turn off the lights and we chill for a little while. And then what happens is, because it's dark, there's not as much light getting into your eye. And so what happens is that iris is going to go and expand to allow more light through that pupil. A bigger hole lets in more light. And so you can see better. And this is why when you first step into a dark room, it takes a moment for your eyes to adjust, as we're waiting for that iris to go so that you can get that more light in. Then what I do is I say, okay, stare into somebody else's eyeballs, and then I flip the lights on. And when I flip the lights on, all of a sudden there's a ton of light, so the iris is like, whoa, too much light coming through, and it goes, and it constricts, and it's quite dramatic. So you can do this in your bathroom, turn off the light, chill for 30 seconds to a minute, and then just be ready to look into the mirror with wide eyes and just kind of stare into it, and then flip the lights on, and you'll see your pupils like, and it's pretty cool. So you should try that if you've never done it. So here's just kind of a picture of what I'm talking about. Here's the dilated pupil letting lots of light in. Here's that constricted pupil for in bright conditions to constrict how much light gets in. And you can watch that change in shape happening as that iris constricts. It's very cool. You can understand red eye with this. So sometimes when you take a picture of somebody, their eyes get this kind of reddish glow to them, and you're like, what's up with the demon possessed dude here? Well, here's the reason why you're seeing red eye. Usually when you get a picture with red eye, there's two things happening. One is it's nighttime or dark room. Two, we're using a flash. And what's happening is, if it's dark, your pupils go like that. And then all of a sudden, when you snap that picture, you're kind of instantly capturing that eyeball really wide open. And so we're actually seeing through that pupil to the back of the eye, where there's huge numbers of blood vessels back there. So the red that you're seeing is actually from the blood vessels in the back of the eyeball. That's cool. So then how do we avoid that? Well, now cameras have different things to reduce red eye. And so now if you have a red eye reducing camera or something, you push the button to take a picture, and it might have a little flash, like a pre-picture flash. It goes blink, 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 and then it takes the picture. The purpose of the blinkety blink is that by blinking, it makes your pupils constrict because of the high amount of light, and then it takes the picture so that you avoid seeing that. So I'll pause so you can just marvel in the wonder of that. Okay. There's another pair of structures, the lens and the ciliary body. So the lens is this structure right here. It's this transparent protein structure. It's actually kind of the consistency of a gummy bear almost. It can change shape to focus on near or far objects. And then attached to that are these ciliary bodies, which contain muscles that can adjust the shape of the lens. So let's look at that a little bit. So here is the lens with two different shapes. Here it's focusing on a distant object. Here it's focusing on a near object. And you can actually experience this yourself. Hold your finger in front of your face and focus on your finger. And if you focus on your finger should be in focus. But if you kind of look with your peripheral vision into the distance, everything else should be blurry. Now choose an object far away from you and focus on that, and your finger should be blurry. And you can kind of shift back and forth between the near and the far, and the near and the far, and the near and the far. And what's happening is these ciliary muscles are relaxing and contracting to change the shape of the lens. And in changing the shape, it changes how the light passes through that lens and helps you focus on near and far objects. That's kind of cool. So here's just kind of another image that kind of shows how that works when you're focusing on near or far objects. Interestingly, we can have some issues with this. Myopia and hyperopia are both vision problems. Myopia is nearsightedness, where you have a hard time focusing on a faraway object. And what happens in myopia is the light waves bouncing off an object are supposed to converge on the retina. If they converge on the retina, the object is going to be in focus. In myopia, the shape of the lens is off a little bit, and or the cornea, because remember the cornea helps focus it too. And that shape change means that they come together a little before the retina. So by the time they hit the retina, then they're out of focus. Hyperopia is similar, except now they don't come into focus until after they hit the retina. And so in both cases, the treatment is simple. You put a piece of essentially glass in front of the eyeball. We call these glasses or contact lenses. They work similarly. And the idea behind these is that they bend the light waves prematurely so that when they do hit your eye, they're at the right angle to be in focus at the right point. So we call them corrective lenses because they're correcting this problem of focusing. Astigmatism is another issue with focusing. Here it's actually the shape of the eyeball that's the problem. The dotted line is the normal shape. In astigmatism, it's a little bit elongated, kind of like a football almost. And then that can cause light coming in at different angles to come in and focus at different points. And then that's going to create multiple what are called focal points here on the retina and blurry vision there. And then a cataract is where the lens is foggy. And the reason this happens is because well, obviously, here's what you're going to see. Everything's kind of blurry. The reason this happens is because the lens is a protein, and ultraviolet light from the sun can damage that protein over your lifetime. And so older people, and maybe you have a dog that had that kind of foggy looking eye, the UV light damage kind of builds up and accumulates, and then eventually it creates this kind of visible fogginess that can impede vision. So the best way to avoid that would be to protect your eyes with sunglasses. They look cool and they protect your eye from getting cataracts. So it's a double win. Wear your sunglasses. But yeah, so the UV light can damage the protein. It's a bit like when you cook an egg. When you cook an egg, the egg white is clear when you first crack the egg and put it in the pan. But as you cook it, the protein changes shape. It denatures is the fancy word and becomes like pure white. So basically with cataracts, what's happening is it's like cooking an egg over the course of your lifetime. It's just slow changes in the proteins of that eyeball that cause the fogginess. Here's a very kind of gross surgery video where they show how to replace a cataract, the lens, if it has cataracts. And it basically involves like poking into the eyeball and grinding up the old lens and then putting in an artificial one. So it's a little gross, but if you think you're up for watching it, you can click that. Finally, I'm going to say about focusing an image. Why do we have two eyes? Fun little game. Take two pencils. You really need two pencils or something with a really fine tip. And if you close one eye and try and put two pencils tip to tip, what you're going to find is that it's really hard to do. You kind of airball past with the two pencil tips. The reason why is the two eyes help with depth perception. That's why we have two eyes. And depth perception was useful in our primate ancestors because they were leaping through trees and whatnot. And so that's really why we have these two eyes. So I think I'm going to pause there for now, and we'll pick up with the second half of the eye in our next screencast.